It's been a while, but I'm back doing healthcare recruiting. It's something that I really do love and enjoy. So I've been going through some of my old footage, and I did find one video that never really got released. This is with Colonel Black. He's an Army veterinarian, and his story is a little bit unique in that he does veterinary research. His story definitely kind of stood out to me, and this is one that I think you guys will enjoy.
Oh, all right, Colonel Black, thank you very much for joining us today. So a little bit of history about Colonel Black. He's been in Army research for quite a while, and there's also another kind of unique thing about him. So, sir, why don't you go ahead and take it away?
Well, hello. It's very good to be here. Thank you for having me. Like you said, my name is Chad Black, but I've been in the Army for 16 years now. Just coming up on 16 years, and it's been a really good career so far. I'm a member of the United States Army Veterinary Corps. So my original training and education was in veterinary medicine, and that's how I came to the United States Army. I was finishing veterinary school at the University of Tennessee in 2003, 2004, and as I was finishing that final year of the 4-year program, the Iraq conflict began, and we had been in Afghanistan for about 2 years at that point. And I thought I would like to see if there would be an opportunity to serve. And I had a classmate that was in a program called Health Professional HPSP. He had a scholarship to be in veterinary school and then to move on to the U.S. Army Veterinary Corps after veterinary school. And I was not in that program, but he talked to me about the Army. And as I finished up veterinary school, I applied for a direct commission that summer after I graduated. And so what happened in veterinary school, certainly there was 9/11, and then there was the Iraq conflict. But I also professionally realized that I enjoy veterinary medicine. The reason I got into veterinary school was because my dad was a veterinarian, and I kind of grew up in a family practice and thought, well, I'm gonna be like my dad. I'll have a small animal practice and take care of family pets in Knoxville, Tennessee, and then that'll be my career. But things were really dynamic and changing. 2001, 2002, 2003, and I got that call to try something different. Additionally, while I was at the University of Tennessee and in veterinary school, I started working in microbiology labs. And so what I realized was, I had this background in veterinary medicine that I'd grown up with, but real foundations of disease, kind of figure those things out in the lab, particularly infectious disease, which is a big problem with companion animals. And so there were labs at the University of Tennessee that I had the opportunity to work in through the summer and through the school year. And one project that really kind of changed my mind about how my career was going to go was one summer I was hired by a professor to study hantavirus. And hantavirus is a really dangerous virus that is transmitted by mice. And it's a problem in the U.S. Southwest where mice will infest people's homes, mobile homes, things like that, and the virus is shed in the urine and the feces of the mice, and then they sweep that up and inhale it, and it causes a really severe illness. So there was an idea that that virus and was in the mice that was in the Great Smoky Mountains National Park in East Tennessee. There had been no cases of hantavirus there, but we wanted to check out and see if that virus existed in the field mice that were in the historical structures in that national park. And so I got hired for a summer as a veterinary student to hike around the national park and trap mice and then test them for the presence of hantavirus. And that was a really interesting job, but it taught me about something called zoonotic disease. So many of the diseases we get as humans come from animals. What's going on right now with coronavirus, that's a zoonotic disease, likely from bats or some other mammals. So hantavirus would be in that same family of zoonotic problems. And I learned a lot about research, how to ask a question, how to use the different molecular tools that laboratories offer to answer that question, create data, collate it, and then publish articles. And I thought, in addition to wanting to serve and go in the United States Army, I also want to be more of a hard scientist. And there are many veterinarians in research, as there are physicians and nurses and dentists and other medical professionals and pure PhD microbiologists and biochemists and things like that. So it's anyone that's in medical research kind of comes from someplace. And I thought in that final year of vet school that the Army might be a place where I could do both. I could serve my country, but I could also channel my veterinary career toward medical research. And so that's what I did. I got the direct commission, and there's a program within the Army Medical Department called long-term health education training that occurs 3 to 5 years into your military career, where you get a chance to go do something in a civilian academic institution that broadens your skill set. And so that was my motivation initially to join the Army, to serve, to practice as a veterinarian, but also out there in the future, pursue a PhD through the Army as well. So that's what I did.
And as far as like the LTHET's concerned, I know that it's also available for quite a few other career fields. So I know for nursing, for example, like if you come in as whether it's like a med surg nurse or a crit care nurse, we have LTHET for CRNA. We have it for the medical corps side if they want to go into an actual fellowship type program. But as far as the veterinary side, I know you said that you wanted to channel your career toward research. So when you got to that point, what channels were available to you?
Well, it's interesting. So there are 5 MOSs beyond the basic veterinary corps MOS, and 3 of those are very research oriented. So I did my initial 2 years at Fort Benning as a veterinarian and a food inspection oversight person, and then went to Korea for a year to fulfill an overseas obligation in order to be eligible for LTHET. And then I had to decide, how am I going to spend this LTHET opportunity? And so there are, like you said, for nurses and physicians, you could go do a specialty within medicine, and a lot of veterinarians go that route if they're really interested in taking care of military working dogs or being a clinical veterinarian. And so I didn't want to do that. That takes you down a different path in the Army. There's another path called, which is for the food inspection intensive public health folks, and they go get a master's in public health, and their careers more oriented towards field units later in their time, or public health activities. So there's MPH for veterinarians, there's clinical specialization. Those are the 2 outside of medical research. And then inside of medical research, there are folks that are really necessary in all medical research institutes that take care of all the animals that are utilized in medical research. And so those are lab animal veterinarians. And the Army has one of the best programs in the world to train lab animal veterinarians, because the Army and the Department of Defense overall needs these highly skilled veterinarians that can manage big research institutes and the animals associated with those. That's more of a regulatory job, and I wasn't really in a management job, and those are wonderful things, but I wasn't really interested in that. I wanted to be in the lab doing things and driving research. There's a second support research function called veterinary pathology, and that's a specialty where people look at how disease progresses in animal tissue, and there's a lot of microscopy and a lot of really intensive training on how disease looks in cells. A highly specialized skill set. I wasn't that smart or good to be a veterinary pathologist. So what I chose to do, but really based on the research that I had been exposed to in veterinary school, was to pursue a PhD. I wanted to be a microbiologist. I thought, I'm a veterinarian. I understand how to treat and manage ill patients, do some level of surgery, you're kind of a generalist as a veterinarian. You get to do a lot of different things to the animal, whether that be a dog or a cow or a horse or a cat. But I really wanted to understand the molecular basis of disease, how bacteria, how viruses interact with cells, and how to create vaccines or drugs that stop those processes or reverse those processes. And so that fifth specialization is it's called veterinary comparative medicine or vet bioscience, and that's an opportunity to go get a PhD in a molecular specialty. And so usually the veterinarians there's only about 25 in the Army that have decided to spend their LSAT to get PhDs, but usually we do that in microbiology or biochemistry or a chemistry science, so that we can be part of, when the Army does medical research, they do it in these multidisciplinary teams. I work with physicians and microbiologists and biochemists to my specific job most recently has been to come up with drugs for malaria and antibacterial drugs. So we can talk about that a little bit more, but it's the way I chose to use LSAT was to become a pure researcher focused on microbiology with a veterinary background, and that has benefit in these multidisciplinary teams that are assigned to make something big, like the next malaria drug.
Awesome. So I know you said that you worked on the malaria drugs and stuff like that. Where did you do your research? Where are those labs kind of located, and do you typically see the same people? Because I know you said it's a very small community. As far as the research, the lead researchers, do they just kind of shuffle around between those few kind of places? And where if somebody wanted to come in, where would they most likely end up?
Sure. So if you're a medically research oriented person, a microbiologist, a biochemist, a physician, a veterinarian, and you're looking at the Army as a potential career, your most likely landing spot for utilization of those skills is the Medical Research Development Command. That's a large command, 2-star general command at Fort Detrick, Maryland. And what they're responsible for is the early discovery and development of medical solutions for the warfighter. So that can be really broad. If you break them down into categories, the things you need for warfighters are you need frontline first aid kind of response technologies, and those types of things are done at a place in San Antonio called the Institute for Surgical Research. That's a very ground medic, research-oriented institute, really trying to stop blood loss and prevent burns and those kinds of things that happen on the battlefield trauma. So that's one lab, Institute for Surgical Research, where a microbiologist, a physician, a biochemist could end up. Another thing that warfighters need is protection against chemical warfare, because a lot of our opponents, a lot of our adversaries out there still maintain chemical weapon stockpiles. And the lab within MRDC that is responsible for coming up with those early solutions is called Institute for Chemical Defense, and that's at Aberdeen Proving Ground, Maryland. And so if you're a biochemist or a physician or a veterinarian with interest in toxicology or a supporting discipline that could help there, you may end up at ICD, or you could pursue a position at ICD. And then when you get into infectious disease, the thing that I'm really interested in, there are two main places within the Medical Research Development Command. One is at Fort Detrick, and it's a very famous lab. If you see Outbreak or some of the movies from the 90s about pandemics, they always have a guy in the old green old green dress uniform, and they say I'm from USAMRIID, so the lab's name is USAMRIID, the United States Army Medical Research Institute for Infectious Disease. Very, very famous place, and the mandate or the mission set for USAMRIID is to come up with medical solutions, vaccines, or treatments for really aggressive infectious diseases, things like, and we break those down into biosafety levels. So something like malaria or diarrhea or something that you get commonly if you're traveling in the third world, that would not be something that USAMRIID deals with. They worry about biowarfare, and they worry about really pandemic aggressive viral infections. So Ebola, those are BSL-3, biosafety level 3 and 4 pathogens. The highest of the levels is level 4. And that's what happens at USAMRIID. The other place, and the place I think is the finest the finest infectious disease research institute in all of DoD, is called Walter Reed Army Institute of Research. And we have a similar mandate to USAMRIID, except our mandate isn't so much focused on potential bioweapons or pandemic disease like Ebola, like Marburg, the really scary stuff that happens less frequently. That's USAMRIID. What RARE works on is the things that hit soldiers and airmen and Marines and sailors every day. And so those are the diseases that we come up with drugs and vaccines for, things like Zika virus, that was a big deal 2 years ago, malaria, which has been historically one of the biggest problems in militaries for the last 3,000 years. Diarrhea is a horrible problem. Bacterial infection in wounds. That's Walter Reed's mandate on the infectious disease side. And so to answer your question, there are many places you can end up to perform your research, but the research is kind of shunted into particular needs for warfighters. Surgical intervention, chemical defense, really aggressive infectious disease, and then the kind of infectious disease that you're going to get when you go to the field. And that's how the big labs are broken up. And I've spent the majority of my research career at Walter Reed Army Institute of Research, and that's in Silver Spring, Maryland.
Awesome. So where are you headed now?
So the Army is an interesting organization, and I keep on learning. And so I told you a little bit about how I got into the Army. I came in saying I wanted to serve my country, but I wanted to be a medical researcher. What the Army wants from you is they want you to be the best medical professional you can be, whether you're a lab technician, 68 whiskey, a field medic, a dentist. They want you to be really good at that, but they also want you to be a leader, and they want you to be a soldier. So you got to do both. And that's one thing I can't emphasize enough to any of the medical professionals that are considering coming to the Army. Yeah, you need to be really good at your profession, but you also have to realize that you're taking on another profession, and that's being a soldier. So one of the great opportunities, one of the things that I didn't foresee happening for my career was that I would get to spend about half my time in medical research and then about half my time in field medical units. And it's really been good for my research, and my research has been good for the time in these field medical units. So I am now, I've just finished my second assignment at Walter Reed. I was there from 2010 to 2013 in kind of a postdoc phase after I finished my PhD in microbiology. And then in 2013, I left to go to a field medical unit. It's called a Medical Detachment Veterinary Service Support. I was the operations officer as a major there. We deployed to Afghanistan. I got to deploy to Africa for Ebola response. It's just a really neat field organization whose mandate is to have small veterinary teams that can deploy out to the field and take care of military working dogs and the food mission, the food safety mission, to make sure the supply chains are procuring and storing the right kind of food and not making soldiers sick. So that has been the other half of my military career, has been being in those kinds of units. I was in the 106 in Korea back in 2006, 2007. I was in the 64th from 2013 to 2016 with several deployments out of there. Spent the last 4 years back at RARE doing medical research, and then I applied to the centralized selection list for command as a lieutenant colonel, and was fortunate enough to get accepted as a commander. And fortunately for me, back at the 64th in Baumholder, Germany. So the unit I left in 2016, I'm in transition now here in Germany, and I'll take command of that unit in about 2 weeks. And so I'm really excited about that. I get to lead a group of about 55 animal technicians, food inspectors, young veterinarians, second assignment, second assignment veterinarians, and then some really seasoned professionals. A veterinarian who's been trained in emergency medicine, and then a warrant officer that has huge experience in how the food distribution chains work throughout the DoD. And it's going to be our job to make sure that our teams of 6, which are a veterinarian, an animal technician, a staff sergeant, food inspector, and a team of 4 to 5 younger food inspectors, can go out to places like at Djibouti in Africa, or down through the Balkans, all through Eastern Europe, and make sure that they can support the war fighters that are out there with food safety. And then if there are military working dogs in the area, make sure that those animals are covered as well. So that'll be my job for the next 2 years. And then I hope to go cycle back to research after that.
Sounds good, sir. I know, congratulations. And I know taking command, especially at a level like that, is definitely something that a lot of people don't think about when you think of a researcher. So a lot of times when you think Army research, oh, okay, you're going to be in a lab, you're going to be running a lab, you're going to be the lab manager. But when it comes to, like you said, with the Army, we don't just want you for your skill set. We want you to be the most well-rounded leader we can possibly have. So again, congratulations on the assignment. I've been lucky enough to be stationed in Germany. I had an absolutely great time, and I'm sure you will as well. But where do you see, I know you were talking about like the kind of future things. Where do you see Army research going in probably the next 5 years or so?
So that's a big question. And, here we are in the middle of a pandemic response. And, 3 months ago, I knew that coronavirus existed and that there was a problem brewing in China. But viruses weren't really my lane. And I thought, well, we'll see what happens. We'll see what happens here. But even as that was going on, the medical research, just the very first week, I guess the first cases were reported in Wuhan right at the end of December 2019. I recall the first week at RARE, the people that should be mobilizing had begun mobilizing around starting to monitor the situation over there, and starting to put together the infrastructure that would be necessary to respond should a response be needed. And so throughout January and early February, the virologists and the vaccine specialists at RARE that have done tremendously fast work in response to past outbreaks, particularly Zika back in 2015, 2016, were ramping up their capabilities to do that again. And concurrently, that time period, January, February, and March, I had been fortunate enough to get accepted to something called the Defense Advanced Research Projects Agency Fellowship. And so that acronym is called DARPA. It's really famous in research worlds. It's not an Army organization, it's a DoD organization. But what they do is they take, they're given a significant budget, and their mandate is to push research fast. And it's not just medical research. They were the ones that kind of started NASA back in the late 50s in response to Sputnik. The Defense Department said, hey, we've got to get a satellite up there. And this Advanced Research Projects Agency was the one that really spearheaded the initial effort to put satellites in space and figure out the rocket technology necessary to do that. And that morphed into NASA. 10 years later, it was the Advanced Research Projects Agency that was figuring out that computer nodes all over the country might be more powerful if it could be connected by phone lines and interact with one another. And so that was called ARPANET, and that was one of the progenitors of the internet. And so the Department of Defense has been a massive driver in innovation, well, since its inception, but particularly in the 20th century. And DARPA has been one of those drivers. And so I was fortunate enough in the middle of this pandemic response to be at an agency like DARPA in a fellowship where I could kind of observe how the Department of Defense was really pushing aggressive technologies and how they were trying to focus those on the response to coronavirus. So during that 12-week fellowship, as the pandemic blossomed, there is an organization within DARPA called the Biology Technology Office, and that's why I was there. It's kind of DARPA has a medical research portfolio, but it's very small in comparison to what they do with satellites and rockets and ships and planes and helicopters. You know, their research portfolio is everything, and they have a small biology portfolio, but it's a very special biology portfolio. What they do is take really cutting edge technologies, things that have just been discovered in the last 3 to 5 years, and they try to get the best people in the world, focusing that technology on a problem that could have military benefit, but also wider global benefit. And this all gets to answering your question on where I see research going. But what was so powerful there, you know, I think we're going through a biological revolution. The way we went through an information and are still going through an information revolution over the last 30 years with the advent of the internet and social media and how we're communicating. In the last 10 or 11 years, the tools to understand biological processes and manipulate biological processes have been discovered, and they are becoming refined. And that's where an organization like DARPA can really set the tone for how we're going to come up with the next therapies and preventative measures for infectious disease, and do it in the right way and in a responsible, thoughtful way, and focus those things toward problems of national defense and of national benefit. And so during this 12 weeks, I was working with, DARPA is not a lab, they're project managers. So they have portfolios, they receive large funding support from Congress, and then they direct that funding support out to a network of academic, industry, or internal DoD or government labs. They try to create these teams around specific problems and then aggressively drive toward answers. And they have people that are working on drugs. That's how I got in there. My job at RARE was in this malaria drugs, antibiotic drug working group. And what I wanted to do was harness some of the really special technologies that DARPA was creating and then bring them back to RARE and test them against the military relevant bacteria, the military relevant malaria. So we have models and we have infectious disease testing capabilities. Think of us like the Aberdeen Proving Ground. You know, when we make a new tank, we send it to Aberdeen Proving Ground. They drive it around to blow stuff up. When someone makes a new drug or a vaccine, I want them to bring it to RARE or USAMRIID and test it in our proving grounds against military relevant stuff. And that's what I was doing at DARPA, kind of creating those relationships and bringing some of that technology back in. And it all kind of coalesced with coronavirus response. And so for the last 2.5 months, I've really been trying to connect DARPA researchers with the test capabilities in MRDC that can advance their coronavirus response efforts. And that's in testing. There's just amazing advances that are occurring in our ability to test for infectious disease. And DARPA has a strong portfolio in that. It's a technology called CRISPR. I'm sure anyone in molecular research is familiar with that, but that is a world-changing technology, and they're applying it toward diagnostics and therapeutics. And then the other the other thing that DARPA is really focused on is artificial intelligence, and using artificial intelligence to come up with new early therapeutics, things that can kind of guide the way we focus research programs. And so that's how I spent my winter prior to this transition over to Germany, was taking those programs and connecting them with people inside the legacy medical research capabilities at MRDC to respond to coronavirus. And it's a scary time. Making a vaccine, making a drug, getting the diagnostics right for this problem is vital. We've got to do it, and it's complicated. And when everyone's rowing in the right direction, and we turn all these capabilities toward that effort, I think good things will come. It's just so early, and I know that's not what people want to hear because it feels like we've been in this situation for forever. But the DoD, the United States Army, is right there with industry, with academia, with the global effort to try to answer some of these questions. And I think good things will result. And the other thing that I hope results is preparedness. As recently as 6 months ago, there was talk that infectious disease isn't something that we really need to invest as much as we have been investing in. My group was part of getting the last malaria drug approved, a drug called tafenoquine, in 2018. It's going to be rolling out here for broad distribution fairly soon, but it's a really good drug, and it's going to be beneficial to the DoD, but also to the world in lowering the malaria burden. But when things like that happen, when you have a success like that, the tendency is to say, mission accomplished. We divest there and refocus. But things like the coronavirus kind of teach us that we need to maintain a skill set and a surveillance on what's happening in the world, and make sure that we can respond as rapidly as possible. And so where I think I see medical research going in the next 4 to 5 years is, how do we make the next coronavirus outbreak or the next flu pandemic outbreak not be like, well, it's going to take 18 months to get this vaccine. We need to create FDA-approved platforms that are plug and play, so that we can, and this gets a little bit technical, but we need to transform the way we think about drug and vaccine approval, such that we can change just the smallest components within those technologies quickly, so that the next time that we have a global pandemic, potentially we cut that development time for a vaccine from 18 months to 3. 3 where we have the technology in our hands and we can start doing safety trials within weeks. And I think we're getting there. I think the biological revolution that's occurred in the last 15 years with technologies like CRISPR will get us to where we can create those technologies to go into safety trials more quickly. I do want to emphasize, though, that safety trials are important. Clinical trials are important, because we've done ourselves no good if we go too fast and create something that has unforeseen side effects that could potentially be as bad as the disease itself. So there's a reason the research model is the way it is. But we need, in the next 5 years, to find where we can create savings and time in those vaccine, therapeutic, and diagnostic development timelines, so that we can be better prepared for the next one.
Awesome. Sounds good, sir. So we're running a little low on time here. One of the things that we've done in the podcast in the past is just pull a random question. This is more of a personal question just for you. But with everything that's been going on recently, there's all the doom and gloom in the news media, everything like that. Tell me some good news stories. So what's been some of the best things that's happened to you in the past 30 days? Give me even just one.
Okay. Well, I guess I would go back to the response of the, the soldiers, the civilians, the contractors, the leadership, the support staff, the janitors, people within my world, this Department of Defense medical research world, are no one's shrugging their shoulders and saying this isn't this isn't something we can respond to. Every single person is saying, what do we need to do to fix this as quickly as possible? And so, I guess what I can tell people is that people are working tirelessly to try to get this resolved, and it's a medical research is a long slog, but trying to make it a shorter slog, and we're trying to uh, create so many potential technologies so that we can pick the right ones quickly and move it forward. And so in the last 30 days, I've seen and I've been a part of these huge consortiums of people, private industry, pharmaceutical and folks coming to DoD and saying, how can we work together? Academics coming to DoD saying how we can work together, and then we putting together thoughtful pipelines that prioritize these projects and move them forward through the tremendous research resources that the Department of Defense has. So that's the positive thing, where the institutions that are supposed to be doing this response are doing that response. And I know we don't see that in the news and as much as we may hope, but there's one of the things that makes the United States strong is that we've built up these institutions that create people like you and me that you're trying to recruit the best people to come in to respond to medical situations in the military. I'm trying to create new drugs and vaccines for military members in the field. Army Recruiting Command, MRDC, those are institutions, and they're doing what they're supposed to be doing. And what I want to do is make sure that we're getting those next generations prepared to do this in 2025 and 2020 and 2030, 2035. That's I need the next lab technician, the next emergency medicine physician that's coming down the pipeline to be really focused on making sure the institution's strong, that the people to their left and right are strong, that they understand the big picture, where DoD, where the United States government, where industry, where academia belongs in all this, and we have to be smarter, and we have to work together, and I think we're doing it. So that's what I've seen in the last 30 days. A lot of effort and a lot of interesting things that are coming down the pipeline.
Awesome. Sounds good. Hey, thank you very much, sir. And I know it's getting late out there in Germany, so I'll let you get going now. But if there's anything that you can say, just a quick one line to anybody who's interested in something like this, what would be your best piece of advice?
I think the possibilities are endless. If you decide to do your medical research profession within the Department of Defense, your career is what you will make of it. If you show utility, if you show an ability to harness the capabilities that are put at your disposal toward an appropriate mission-oriented use, you'll be rewarded with more responsibility and more opportunity to do really cool things. So that being said, it's not easy. You got to learn how to shoot, move, and communicate, and be a soldier too, and that's cool. That's kind of a nice, it's kind of a nice other half of the coin. So it's been a really satisfying career thus far. There are several more things I want to do, and I was fortunate enough that I was around somebody back there in 2003, 2004 that said, "Hey, why don't you think about this?" It really made all the difference professionally for me.
Thank you. Well, I'm sure we'll probably have you back on here, the podcast, in the future at some point. But thank you very much, sir. And I hope you have a good day.
Thank you. It was a pleasure speaking with you.